initially the way that public health professionals talked about monkeypox, or even the way I've heard about it in other media, it sounded almost like it was an STD. The conversation was about it spreading primarily among MSM, men who have sex with men, gay and bisexual men. But now it doesn't seem like that. We have 2 cases of children, one of whom I believe was infected in the nation's capital. The Associated Press is reporting that people can catch monkeypox from touching items that previously touched an infected person's rash or bodily fluids, such as towels or bed sheets. That's thought to explain the infections of those kids. That scares me. I stay in a lot of hotels. Should I be worried about doing things like staying in a hotel?
Well, monkeypox is not new. It has been endemic, as they call it, in about a dozen countries in Central and West Africa. And there, children got monkeypox, adults got monkeypox. And as you point out, people got monkeypox, mostly from skin-to-skin contact, but also from sharing beds, sharing bedclothes where somebody who had monkeypox had been using. It's not casual touching, and the hygienic practices of hotels should make you assured that you won't catch it in the hotels that I expect you stay in. But people who share beds with somebody who has monkeypox are, in fact, at risk. But the vast majority of transmission identified in this current ongoing global outbreak has been through skin-to-skin contact related to sexual activity, intimate activity.
If you could just explain that, because I know people who are very nervous, very worried about it, but not because they're even sexually active. I mean, can you get monkeypox if someone has it and they, let's say, have sweaty hands, for instance, and you shake their hand and you touch their hand and then you touch your eyes or other orifices where that fluid could then get into, let's say, your eyes, or you touch your nose? Like, can it spread through that kind of contact?
Let me just make clear that this is an evolving outbreak, and we're seeing it transmitted in ways that we haven't seen before. So we're all learning about monkeypox, but everything that we know about monkeypox suggests that it is not that sort of casually spread, not a brush of the hand, rubbing shoulders on, on public transport. It's more prolonged skin-to-skin contact, and the main way, and what we really have to talk about, is that it's being transmitted through skin-to-skin contact is through sexual encounters. So, I think everybody is at risk for getting monkeypox. Skin-to-skin contact is something that everyone can experience, but the main way that we're seeing this transmitted in some 18,000 cases that have been identified around the world so far, and in New York State, where we've identified close to 1,400, is a report of a sexual encounter. So, I understand that people will be nervous, but the main message that we need to get out is that we are seeing it transmitted principally in a group that has been previously marginalized and has many bad memories, but we have to communicate that we need to support them in getting access to vaccine, to treatment, and to preventing exposure. So I sympathize with what you're describing, but it is not the way we're seeing this outbreak spread.